One big picture question. We've learned a lot about the complexity of claims, transparency, perverse incentives, manual work, problems with heterogeneous technologies and policies. If you could take out your crystal ball, what would a better future state look like for patients to receive better quality of care and providers to be paid for delivering that care fairly and more easily?
I'm glad you asked that because I mean, a lot of the chats we're having, even with the founder stuff about having to understand the system, it makes it sound like it has to be that way, or sometimes it's a good thing, or it's a necessary evil in our system. And I think as entrepreneurs and as folks like yourselves that are supporting entrepreneurs, it's important to have that, that disruptor vision in front of mind. And internally, we call it the 2030 George Jetson vision of healthcare, right? For those of us that are old enough to enjoy the Jetsons.
Yep.
And so that vision effectively for the revenue cycle is patient goes to see physician in any context. That interaction is recorded, right? That recorded interaction is then automatically using AI turns into a coded claim, like we talked about, right? Then that coded claim is automatically with AI, say maybe providers AI, but with the payers AI, is all just kind of boop, 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 boop. Everything's kind of handled and coverage is affirmed and payments are all maneuvered. And in 99.9% of cases as a patient, before I walk out the door, all that's kind of handled and all the notifications are in my phone and all the data is moved from system to system. That's the vision of it. And then if you mix in the regulatory, the lawyer side of me is looking at this is the part I'm less certain about happening. That there's more pieces that are hard to control there. But I hope that the regulatory landscape and the policy-based landscape becomes much easier for folks to follow and understand, and for providers, patients, and stuff to implement, and companies and startups to implement, and stay on the cutting edge of. So that's our view, is that, at the end of the day, in healthcare is about providers and patients, right? I mean, that's just what it is. Whether it's a device, whether it's a facility, whether it's an insurance company, or us, a software company, we're all supposed to just be there to support the core of delivering care from one human physician to human, patient. And so, and that goes for government employees and lobbyists and everyone. We're all supposed to be here rowing in that same direction. So as an idealist, as a technologist, as a disruptor, my vision for 2030 is that we, have transparency and efficiency. We all get to focus on our lives.